Thank you so much to those that are jumping on. Our last live, Dr. Rusty kindly covered a low response to ovarian stimulation. This evening's live, we will be discussing a normal response to ovarian stimulation. So before we get started on the questions, Dr. Rusty, could you please give us a brief introduction on the topic?
Yes. Thanks for everyone joining. So essentially, when we say normal response, low response, high response, we mean the response of the ovaries to the stimulation in IVF. So that's one of the biggest factors which determines outcome of IVF. This way, we are very much interested in how ovaries responded to our stimulation. So normal response to ovarian stimulation, in short, means that you produce from 5 to 15 total number of eggs. So that's a very simple way of understanding whether your response was normal or low or high. If you produce less than 5 total eggs, that's low response. More than 15 total number of eggs is high response. So we can work this out by simply knowing that what's actually average number of eggs women get when they do IVF. So across the board, average number of eggs you get is 10 total number of eggs, maybe 8 mature eggs. So that's the average. Let us say IVF clinics, when they offer IVF program from age of 20 to 45, if 1,000 women did IVF cycle within, let us say, 6 months of period in one IVF clinic, if you average out, so you get approximately 10 eggs. So that's why if you get more than 15 eggs, that's high response. If you get less than 5, it's low response. So the average is 10. So how you can tell whether you had a normal response or not? So you tell this by looking, of course, how many eggs you got. And also, it doesn't tell the full story. Let us say you got low number of eggs, but you had a very good response to stimulation. So this can happen if your ovary is not accessible in egg collection. Let us say you had a good response, you produced a lot of follicles, good mature follicles, but you had only 4 eggs. So this can happen if your ovary is not accessible when you have egg collection. Let us say one of the ovaries is very high, where you had a lot of follicles, and only one ovary was accessed. So that means your response was good, but number of eggs you got is low. So this is why when you see low response, then next thing you should check whether there was any issue accessing ovaries and aspirating all the follicles. So, and also you look at the response by looking at the stimulation chart. Of course, when you do IVF, when you're doing stimulation injections for 10 days, you have a chart which monitors how you're responding to stimulation. So you monitor by doing blood tests, estrogen levels, progesterone, LH hormone levels, and also you do ultrasound scan. So it is a couple of scans, generally an average couple of ultrasound scans. Looking at the chart, you can tell whether you are actually responding well or not during the stimulation. So one of the signs of good response is your estrogen levels, because only source for the estrogen is growing follicles which contain egg. If you have high level of estrogen, that means your ovary is responding well, producing a lot of estrogen. So which means, especially if you have good number of follicles, it's matching to your estrogen levels. That indicates actually your response was good. If you had a low number of eggs, so then you should assume there was another problem. So one of the problems, of course, one of the ovaries not being accessible, which means all the follicles were not aspirated. Or second reason is a poor maturation of the eggs. Your ovaries may respond well, produce a lot of follicles, high number of estrogen, a lot of mature follicles. These are follicles bigger than 14 millimeters. Total number was, let us say, 10, 12, 15, but you only had 4 eggs. Both ovaries were accessed during egg collection. That indicates your response was fairly good, but you had a problem of maturation of the eggs. So which means follicles contain egg. Without egg, follicle cannot grow. So follicle was aspirated, but a lot of these follicles didn't give egg, which means eggs inside the follicles were immature. So then you need to understand, try and find out why you had a problem with the maturation of eggs. So it can happen if your trigger shot doesn't work, If there's any technical problem with the trigger, let us say you spilled the trigger or it wasn't stored properly, so the actual drug didn't work, which means it didn't reach your follicles and your receptors didn't actually register the drug, or you may have a deficiency on your LH receptors, which means you actually did the trigger, no problem, but the trigger didn't get registered fully because the receptors or sensors on your follicles didn't register the trigger. So then that you investigate with your specialist and try and understand why you had a good response but low number of eggs. So overall, we define normal ovarian response looking at how many total number of eggs you got. If you got 5 to 15 total number of eggs, that's normal response. And also if you had a poor response, we try to understand whether actually your response was good, but you had the issue with the maturation of your eggs or accessing the follicles for aspiration.
Thank you, Dr. Asti, for that introduction on a normal response to ovarian stimulation in IVF. So within that, you did explain how you can get a normal response. Why would you say a normal response is the best response?
Okay, so why normal response is good is because first, in IVF, you want to minimize the interventions, minimize the stress of the treatment, and maximize your chance of successful pregnancy. So which means you want to do at least possible number of IVF cycles, get good number of embryos safely, and try and achieve success in that cycle of IVF without doing repeated IVF cycles. So if you have a low response, which means if you're producing low number of eggs, that means you don't produce good amount of high-grade embryos, which means you may end up doing multiple IVF cycles trying to get success. So if you have a high response, which means more than 15 eggs, then you have a risk of ovarian hyperstimulation syndrome. That's not optimal. So really you want to find in the middle option where you have a good number of eggs, and you so that you can produce good number of embryos and without having very high risk of ovarian hyperstimulation syndrome. So normal response, although we say 5 to 15 eggs, but optimal response is 10 to 15 eggs. So if you have 10 to 15 total number of eggs, so you should produce good number of high-grade embryos. If you have a normal utilization rate, out of 10 eggs, you should create 2-3 high-grade embryos. Out of 15, you should create 3-4 high-grade embryos. That's a good number. So, and at the same time, you don't have a very high risk of ovarian hyperstimulation syndrome. So normal response, 5 to 15 eggs, total number, optimal response to 10 to 15 total number of eggs.
Thank you, Dr. Asti. And how can you get a normal response to ovarian stimulation with a low egg reserve?
Okay, so there are a number of factors determines your response to stimulation. Some of them under your control or your specialist control, some of them not. So first is first factor which determines how many eggs you get in IVF is a baseline egg reserve, which means if you have a high egg reserve, we are very likely you have a high response or normal response. So if you have a low egg reserve, let us say your AMH is 5, your antral follicle number is 7, so it's very difficult to get normal response because actual any given time number of follicles ready for stimulation will be low. So first is your baseline egg reserve, because every month, every day, your egg follicle number on your ovaries change, but it varies around the baseline. So let us say if your AMH is 5, in good days you may have 8 follicles, not so good days you may have 4 follicles, but it will be varying around the baseline. So second thing is determines your response in how many follicles you have on the first day of your stimulation. You had a menstrual period when you're stimulating, then depends on how many follicles you have that day ready for stimulation. We call those follicles antral follicles. All these follicles sitting on your ovaries, which measures less than 1 centimeter, is called antral follicles. So, and third thing is size of those antral follicles. Antral follicles can range from 1 millimeter to 10 millimeters. So bigger antral follicles, 7, 8, 9, 10 millimeter follicles are ready for the stimulation. Smaller follicles, let us say 2, 3, 4 millimeter follicles, they do not have receptors yet. They're not ready for stimulation. They need another 7-8 days before they develop the receptors or sensors before they register your drugs. So that's very random. It's not controllable. Let us say you have 10 antral follicles, a lot of them are large, 7, 8, 9, 10 millimeters, then you can have a good response. You can have a 6, 7 eggs out of that. If you have a lot of follicles, small, but despite having 10 antral follicles, most follicles small, then you may have a low response. That's very random. It's not controllable. So third factor which determines your response is your FSH drug. So what FSH drug you're using, whether this FSH drug is matching your receptors, and dose of the FSH drug. So one of the ways of increasing your response is, if you have a low reserve, is to start with a high dose of FSH, 450 units, or even maybe even higher dose, to push a lot of small follicles into the growth and maturation phase. So FSH dose, drug, and also trigger. What trigger you're using, trigger dose, and the type of the trigger, and of course egg collection. And egg collection, various techniques are used. Best technique for egg collection is aspiration every single follicle, small or big, systematically on both ovaries. So because when we're doing egg collection, just by looking at the size of the follicle, we cannot tell whether this follicle contains mature or immature egg. So we need to aspirate all the follicles. So systematically, left side first or right side first, and next ovary. If you empty all the follicles, then you know that you're trying to get as many eggs as you can and giving a highest possible chance of success to that patient in that cycle. So these things determine, yes, some of these factors you can see under our control, which means that what drug we use, the dose of stimulation, duration of stimulation, trigger, and some of them is not under control. If you have a low number of follicles, then you may, despite doing everything, still you may have a low response.
Thank you, Dr. Asti. So similarly, how can you get a normal response to ovarian stimulation with a high egg reserve?
Okay, so yes, so in patients with high egg reserve, getting normal response is not that challenging because there's no shortage of follicles. Because what happens is, let us say you have a high egg reserve, then if you have high egg reserve, which means any given time you have a lot of follicles ready to go. So let us say in patients with PCOS, so if the AMH is 40, antral follicle number is 70, any given time they may have like 50, 60 follicles ready for stimulation. So which means that if you stimulate efficiently, you should be able to get good number of eggs. But here the challenge is the risk of ovarian hyperstimulation syndrome. If you're not careful, if you overstimulate, you may end up producing too many eggs, which we don't want. We really want optimally 10 to 15. Again, that's not under full our control, because in patients with PCOS, you use low dose of stimulation to reduce risk of ovarian hyperstimulation. But if a lot of follicles sitting in the same level of the development, then suddenly they can take off. Suddenly 20, 25 follicles start growing at the same time. You cannot selectively stop some, selectively increase the growth of all the follicles. So then what happens is, if you have a high response, then you have to aspirate all the follicles. First, you aspirate all the follicles in order to get highest possible chance of successful pregnancy in IVF. And the second reason you aspirate all follicles, so that you reduce the likelihood of ovarian hyperstimulation syndrome. Because when you aspirate the follicles, you remove the granulosa cells, which are responsible for ovarian hyperstimulation. So yes, in patients with high response, in order to get a normal response, we use a low dose of stimulation. We can use 125 units of FSH, 150 units of FSH, depending on all the parameters, to try and get low number, like 10 to 15 eggs. But if you have a higher response, then we try and reduce the risk of ovarian hyperstimulation by using agonist trigger and aspiration of all follicles.
Thank you. And my final question is, if you did have a normal response, would you recommend using the same protocol for future cycles?
Yes, so essentially the response, which is a quantity, yes? So when we say 5 to 15 eggs, that's quantity of eggs produced, yes? So this is one side of equation. So also you need to look at the quality of eggs produced. So quality of eggs you produce, you can tell by utilization rate. Let us say you produce 10 eggs, and out of that, if you produce only one high-grade embryo, that's poor utilization, which is a 10% utilization. So if you produce 3 high-grade embryos out of 10, if 9 fertilize, you produce 3 high-grade embryos. So that indicates you produce 30-35% utilizable embryos. That's normal utilization rate. If you produce more, that's excellent. It's very high utilization rate. So that tells you about the quality of the eggs you are getting in IVF cycle. So if you had a good quality embryos and with good utilization rate, good number of eggs, then yes, you try and replicate exactly same protocols. Protocol means same regime for down regulation and same drugs, same dose, same trigger, try to do same duration of stimulation. However, each cycle can be different. That's natural due to natural variation in the follicles. So even if you use exact same drug, next month you may have very different result. That's because of natural variation in egg quality, follicle size, sperm quality. So this is change. The naturally egg and sperm production changes all the time. So you may have slightly different result, but you do your best to replicate good result by using exact same protocol in the next cycle if you need to do more IVF cycles.
Thank you, Dr. Asti. So just to summarize, our last live was a low response to ovarian stimulation. This evening we discussed a normal response to ovarian stimulation. Our next live tomorrow evening will be discussing a high response to ovarian stimulation and IVF. So thank you so much for joining to those that jumped on. The recording will be posted to Dr. Asti's page on Instagram and TikTok. And thanks so much for your insights, Dr. Asti.
Thanks, Gabby. Thanks for organizing this. I hope that the listeners are finding it useful. So if you have any questions about IVF, please leave questions on your comments. So we try and address as one of the Q&A sessions. Thanks, Gabby. I wish everyone a nice evening. Thank you.
Thank you.
Thank
Bye,
you.
everyone. Bye,
Thank
Dr.
you.
Asti.